Alright, so this is my IVPB competency. The first thing I would do is get my order and compare it to my MAR. Be looking for the 5 rights of medication administration, the right patient, right medicine, right time, route, and dose given. So I've got Mr. Jones here as my patient. I'm given cefotaxime sodium as my medicine, 750 milligrams at 9 o'clock with his 9 o'clock meds, and I'm giving it through IV piggyback. I'll also check the MAR in order for any kind of allergies the patient might have. The max daily dose is 12 grams, so my dose is well within that number. The medicine can be diluted with sterile water, D5W, or normal saline. I've got mine here in normal saline, and it's running here. It's going to be running with my primary solution of normal saline as well. In the book, it also says it can be further diluted with 50 to 100 mils of a compatible solution. And that's what mine is, 100 mils of normal saline. The rate of administration is a single dose is given over 30 minutes. Contraindication is any previous hypersensitivity reactions to cephalosporins. Some things that I would monitor for are CDC panel, especially if the drug treatment is more than 10 days. I would also monitor BUN, creatinine, and their renal function, and as well as the drug serum level and the PT. I would also tell the patient to report any signs of, or report diarrhea or bloody stools that occurred during the treatment or up to several months after the treatment. So once I've done that, I will go in and grab everything for my medicine stuff. So the first thing I'll do is wash my hands. Once I've done that, I'll get my medication here and compare it to my MAR. Make sure I've got the right MAR, the right medication for my MAR and patient, as well as check allergies again. I would also inspect the med for any kind of impurities in the solution or cracks in the bag or anything like that. I would also label my bag, which I've already done here, with cefotaxime sodium. So the drug, the dose, 750 milligrams. The patient's name, Mr. Jones, room number, start time and date, as well as the flow rate. I would also check the expiration date on the medicine as well, and put my name on there as well. So once I've done that, I will then prime. I've got my secondary tubing here, and I'll go ahead and prime my tubing. So using a sterile technique, remove this blue cap, remove the cap on the unit here, and insert it straight into the bag and twist. Then I'm going to hang this here to go ahead and prime the line. So it's primed. So we're good to go there. Once again, I would compare my medication to my MAR if I hadn't done so already. And I'm now ready to go into my patient's room. I didn't state earlier the rate that I'm going to be giving it is 200 mils an hour or 33 drops a minute. That also translates to 8 drops for every 15 seconds once I get to regulating here with my primary line. So I would go into my patient's room. I would identify my patient using 2 patient identifiers, name and date of birth. Also ask the patient if he had any allergies to this medication before. I would also inspect my IV site, make sure it's intact and that there's no signs of edema, any kind of reaction, hives, redness, itching, anything like that, swelling. Then I would check and make sure it is patent. I would lower my bag below the side of the IV and check for blood return. And I do get blood return, so the IV is patent. And then once I've done that, I'll wash my hands. And then I'll also explain the procedure to my patient, saying that this is an antibiotic that's going to help get you well quicker. We're going to do this through your IV. Report any signs, any diarrhea or bloody stools during this medication or a couple months after. as well as let me know if you're having any difficulty breathing, itchiness, pain at the IV site, redness, swelling, anything like that. So, ready to go, get this started. First thing I would do is lower my bag here, my primary bag. Zach, I'm actually going to come around to you because once I get to regulating with my watch, it'll just be easier if I come on this side. I will also use the port closest to the bag for the secondary tubing. Go ahead and hang this up too. So I've got that hanging here. Now I will take my alcohol swab, clean this port real well. Once that's clean, I'll discard that. And then remove my cap. Go ahead and, using sterile technique, screw that on there. So now I can open this wide up. Let me make sure I'm clamped down here first. So I'll open that up. Alrighty, so we'll be regulating with the medicine chamber here, but I'll be using the primary lines clamp here to do my drop factor. So I'm going to take my watch off so it's a little bit easier for y'all to see. So first thing we're looking for is 8 drops in 15 seconds. So we're going to start at the 45-second mark. Let me make sure it's flowing first. Make sure I got all my clamps undone. Clamps are undone. That's wide open. There it is. All right, let's see. Let's get it. All right, so I got my drops going. We'll start at the 10-second mark. So starting right now. Now, 1, 2, 3, 4, 5. That's going to be too quick. So we're going to start at the 25-second mark, looking for 8 drops in 15 seconds. So now, starting with 1, 2, 3, 4, 5, 6, 7, and 8. So we're good there. Next we'll be looking for is 33 drops in 1 minute. So starting at the, we're going to start at the minute mark. So we're going to wait for a little bit here. See if we can get 33 drops in a minute. So starting now. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34. So we are 1 off, 2 off actually. So we're going to restart this. At the 10-second mark, looking for 8 drops in 15 seconds. Starting now. So that was 1, 2, 3, 4, 5, 6, 7, 8. So we're good there. So at the 30-second mark, we'll count for a minute, looking for 33 drops starting now. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33. So we were good there. So I would let this run over 30 minutes until it was empty, until the dose was given. I would come back and observe for any kind of reaction symptoms that the patient might have had, like itchiness, difficulty breathing, redness, anything like that, swelling. I would also check the patient's IV site, ask Mr. Jones, how are you feeling right now? Is there any pain here on your IV site? There's no swelling, edema, anything like that. No kind of reaction. So I would come back in. I would clamp this off here. But I'd clamp this off here. So that's my secondary tubing I just clamped off. So that's clamped. I detach here. Dispose of this. I'll dispose of that. And then I would regulate the patient's primary. First, I would hang this first. Hang that back up tall. And then I would regulate this back to whatever is prescribed in the patient's order according to the doctor's orders. And make sure I've got that set for however, for that rate. And then I would go and document.